Hey there. Hey everyone. I'm Kendra Perry. I am a functional diagnostic nutritionist and I specialize in female hormones, GI health, and heavy metal detox. So if this is your first time joining me, it's very, very nice to meet you. And I'm pretty excited about today's video because I'm actually going to be going over the case study of a GI-MAP, which is a very, very important GI panel that I use with pretty much all my clients. And I honestly get so many questions about the GI-MAP. So a lot of people with chronic GI issues, they're doing a ton of research and ultimately they'll end up coming to the GI-MAP, which is a very effective gut panel for identifying infections, leaky gut, inflammation, immune function, stuff like that. So I actually want to go over a case study of one of my clients, Lacey, we'll call her Lacey, so you can see what her test initially looked like when she came to me, the symptoms that she was initially experiencing, and how we worked through the different protocols to actually 100% resolve her chronic GI symptoms. This is an amazing test. And if you want a copy of the case study that I'm going to go through today, you just have to type amazing in the comments below and I'll just send it to you through Facebook Messenger. I have the entire protocol that I used in this document plus copies of the lab test so you can get an idea of what it would look like. Okay, so I am actually going to share my screen. So here we go. And I'm going to take you through this. So Lacey was a client who came to me just over a year ago. She was a 36-year-old female. She was an IT consultant and she was having a really rough time. She was currently eating a standard American diet. So unfortunately, she was eating a lot of processed food. She thought she was eating healthy, but she was eating a lot of things that came from a box, that came from a package. And because of that, her sugar consumption was much higher than desirable. She was eating lots of unhealthy fats. She wasn't getting enough protein, which is pretty common with many of the women who I work with. They don't like eating a lot of meat, so they're just not getting the protein that they need. She wasn't getting enough sleep either. She was staying up really late. She was doing a lot of her work late at night, and then she was getting up pretty early in the morning. And she was pretty stressed out overall. She didn't like her job. She was, really stressed out with work. She had a bit of a relationship stress, and she kind of dealt with that by doing a ton of different exercise. So she would go to CrossFit, she would go to spin classes, and she would do this 5 to 6 days a week. And she would actually get up early and deprive herself from even more sleep just so she could do this really intense exercise. She was trying, she was doing her best. She was taking some supplements. But yeah, magnesium citrate, really low form of magnesium. Because her main complaints were bloating and gas, she was doing neem, berberine, peppermint. She was also taking a vitamin, multivitamin and some vitamin D. And she was taking quite a few over-the-counter pain meds just because she was having so much pain with the migraine. So her main complaints are right here. She had chronic fatigue. She had horrible constipation where she just couldn't eliminate at all. She would only go once or twice a week sometimes, which is pretty bad. So, reabsorbing a lot of the toxins she was being exposed to. She was also severely bloated. Pretty much everything she ate was just bloating her. She said even water would bloat her. And then she was having, migraines a few times a week. So she was having a really, really hard time. So we ran some tests with her, but I do want to show you her first GI-MAP. So this is a gut panel that I use. It is amazing. It's very sensitive. It uses a more cutting edge type of technology than a traditional stool analysis. And so because that, it's very sensitive. It's very good at picking up different infections, parasites, bacteria, yeast, viruses, worms, which is a cool new addition to the test. Plus it will look at inflammation, digestion, detoxification, and a few other things as well. So this was the first page of her test. So right off the bat, down here, these are some major issues, like really, really major. So these parasitic pathogens here, I like to call these the big bad three because these are the most damaging parasites that you can get. Cryptosporidium, Entamoeba histolytica, and Giardia. And she does have 2 of them. I've actually had all 3 of these, but that's me. So this one right here, the Entamoeba histolytica, this is the most dangerous parasite that you can get. Most doctors know about this. It causes a lot of disease. Basically, it is a parasite that doesn't stay in the GI tract. It travels into the brain, into the lungs, and into the liver. And in the liver, it has the opportunity or possibility of creating a liver abscess, and that's what can actually kill people. So this is a potentially fatal infection. So it's no wonder she was having so much fatigue, why she was having so much GI issues, because this is a really, really serious infection. And this is actually a good lesson for why it's so important to test, because I come across so many people who are just, they think they have a GI infection, so they're just taking like some antimicrobials, they're taking different herbs that they've heard of that will help. Well, in the case of this one, in the case of Entamoeba histolytica, it does not respond to herbal protocols. This is probably the only infection where I will send someone to their doctor to get a prescription for antibiotics, a very specific antibiotic. A lot of antibiotics don't touch this, but there is a couple specific antibiotics that will get rid of this, and it will generally get rid of it within 2 to 3 weeks of treatment. So and that's why I'm such a proponent of testing. I think you should always test, not guess. This is because with this one, if you didn't test, you would never know that you have this, and this could actually exist in you for years and just cause so much sickness. Okay. So pretty big deal right there. Giardia is another parasite. Some people also call it beaver fever, but you get it from drinking contaminated water or swimming in like a contaminated lake or pond. It's nasty. It causes a lot of toxins to be released in the body. It will cause a lot of dysbiosis. So, right here, she has 2 of the 3 big bad parasites, right? So no wonder that she's feeling the way that she was feeling. Okay. On top of that, she also has H. pylori. So Helicobacter pylori is a little spiral-shaped bacteria. It likes to burrow into the lining of the stomach. And typically the stomach is very acidic, and that's what allows you to break down and denature protein. But H. pylori actually changes the pH to alkaline. So when the pH is alkaline, you actually can't break down protein. So you have a lot of protein malabsorption, and then you have these large chunks of protein traveling through the GI tract and getting fed on by other types of bacteria. It will cause a lot of putrefaction, a lot of gas production, hence bloating, right? So this is a really nasty infection, and unfortunately she does have this VAC-A virulence factor, which just means that she has a strain of H. pylori that is more likely to lead to something like stomach ulcers and stomach cancer. So this infection is actually a primary cause of stomach cancer. So yeah, right off the bat, we're seeing some major infections. It's not going to be a quick fix, but we can definitely help her. Okay. And then as I scroll down here, we can see her, this is her normal flora, which some of it is looking a little bit low. So I did put her on a probiotic. And then we're also seeing some of these potential autoimmune triggers. So these are bacteria that have been shown in some research to potentially trigger certain types of autoimmunity. This one is specific to rheumatoid arthritis, and this one is just specific to autoimmune conditions in general. So yeah, some pretty nasty opportunistic bacteria. This is going to crowd out her friendly flora. So definitely an issue, definitely something we want to address. And then she also has one of these parasites, not as nasty as the 2 other parasites she has, but, not favorable. We don't want to see parasites in people, so we're going to address this parasite as well. And then finally, she does have Candida. She doesn't have Candida albicans. This is the strain of Candida that most people are familiar with. She has a different strain of Candida. It's in moderate amounts, and she also has Microsporidium, which is considered a parasitic fungus. Really, really nasty fungus. Causes a lot of pathology, causes a lot of symptoms, a lot of fatigue. So, we're seeing a lot of infections in Lacey, and it's really validating how she feels, right? Okay. And then if we go down, we can see secretory IgA, which is a marker for immune system. You can see how depressed it is. So the range is 510 to 210. And considering how many infections she has, you would actually expect to see this really elevated. That would show you that the immune system is on high alert and actually responding to those infections that she has, but it's so low. So these infections are really wearing on her immune system, and it's possible that these infections have actually been going on for a really long time. And that's why her immune system just simply isn't mounting a response anymore. Okay, so anti-gliadin IgA is the section of the immune system that responds to gliadin, which is a component of gluten that people react to, and this is really high. So I don't often see ones this high. Anything over 300 can show that your body is mounting an inflammatory response to gluten, but this is so high, I actually was like, this could be a sign for something like celiac disease. I don't diagnose, I am not a doctor, so I sent her to a doctor to get tested for celiac to see if that was something she had. But regardless, even if she doesn't have celiac, we still need to follow a very strict gluten-free diet because her body is having a pretty negative, nasty response to that protein. Elastase 1, this is a marker for pancreatic enzyme function. And you can see it's quite low. 200 or above is the range. I like to see 400 or higher from a functional standpoint. So she's at 110. So pancreas is a bit sluggish. She's not getting good enzyme production, so she's not breaking down her food very well. And then calprotectin is a marker for inflammation in the gut. And this is really high. And considering how low her immune function is, this is very high because it's like she's barely being able to respond. Her immune system is not responding. And then she has this insanely high inflammation. So this is actually a lot higher than it looks because of that. So this was another situation where I sent her to a gastroenterologist just to get her checked out for something more serious. Of course, those infections that she does have, they can definitely cause a lot of inflammation, but I always like to be safe. I want to make sure I'm within my scope of practice. So I did send her to a doctor to get that checked out as well. Okay, so what did we do to help her? So we'll go up here. And so we actually, we had to do a lot of work with Lacey just because, you know, she wasn't eating a super healthy diet. She wasn't living a super healthy lifestyle. So we put her on 100% gluten-free diet. Paleo, I had her eliminating grains, dairy, legumes, beans, sugar. A lot of those things can be hard to digest, and we could just tell that she clearly wasn't digesting. So we really had to clean up her diet. We got her eating 4 to 7 tablespoons of added fat daily, of healthy fats. These are the ones I usually recommend. And I really upped her protein content. So we had her starting to eat a little bit more meat. We also added in a really high quality protein powder to just get her some more of that protein. We started introducing some really healthy carbs like root vegetables and some low sugar fruit. And I also significantly upped her cooked veggie intake. I'm a big fan of cooked veggies because they do increase mineral content. And when your body is having trouble digesting, raw veggies just aren't your friend because they are harder to digest. Okay. So when I work with clients, I like to use a DRESS protocol. So DRESS stands for diet, rest, exercise, stress reduction, supplements. And then I also added another D for detoxification because I think that's really important. So it really is a holistic approach when I work with clients. It's very important. We can't just give people supplements. We can't just give people, tell them to sleep. We can't just clean up their diet. Really, we need to address all those things. Okay. So we also got her resting more. We got her going to bed early, in bed by 10:30 every night. Started getting her to prioritize that 7 to 9 hours of sleep, and then avoiding screens and bright lights before bed, just so that she wasn't affecting her melatonin, which is her sleep hormone, which can be affected by bright lights. So we had her sleeping better, which was really helpful. I did have to tell her to slow down on her exercise because she was exercising way too hard for her energy level. She was exhausting herself. And as you go through a healing program, especially when you're killing off infections, they do dump their toxins. So it is pretty hard on the body. So you really do need to rest. So we had her doing more restorative workouts, walking, Pilates, yoga, stretching, and avoiding all that intensive cardio for the duration of the program. So she was a little resistant to that, but once she started resting more and taking more time for herself, she did see how much it helped. So we had her implement some stress reduction techniques, daily gratitude journal, meditation practice, more restorative yoga and journaling. I referred her to a couples counselor for her relationship issues, which I know she did find helpful. And, she just wasn't doing enough things that were fun for her. So I really encouraged her to get outside, to do things with friends, and just to spend more time doing things that made her happy. I got her on some foundational supplements, and so this was for the duration of all the protocols that she ended up having to go on. Ashwagandha to mitigate the stress response. I got her on some high dose magnesium glycinate because I'm a big fan of magnesium for everyone. GI Revive is a really great gut rebuilder, so I got her on some of that. Megaspore Biotic is a really potent probiotic, so to just support that sort of friendly flora and microbiome. I had her taking some interphase and biocidin. This helps address the biofilm. This is actually really, really important for any infection elimination because the biofilm is like this sticky polysaccharide matrix that bacteria produce between them, and they can actually physically kind of hide under it as a barrier, but they also use it to kind of communicate among each other. So that's how they kind of resist and adapt to some of the treatment you might be giving it. So a big part of getting rid of infections is disrupting the biofilm. So these are biofilm disruptors. I also gave her some colostrum, which will help improve her immune response, some digestive bitters to help her produce more enzymes, and some boswellia as an anti-inflammatory. And for this protocol, I actually had to put her on 5 separate protocols just because she had so many infections. This was definitely a bit of a worst case scenario. I mean, not all of the ones I see are this bad, but it's not uncommon. So first, I wanted to address the Entamoeba histolytica. If you'll remember, that's that really dangerous, potentially fatal infection that a lot of people that just won't respond to herbal protocols. So I referred her out for an antibiotic, and fortunately, the antibiotic that kills the Entamoeba histolytica will also kill Giardia. So this was kind of like a 2 birds with 1 stone. We had her on 3 weeks of those antibiotics prescribed by her physician. And after those 3 weeks, we started the second protocol. So the whole time she's taking all these foundational supplements. So the second protocol was 60 days. And the next thing I prioritized was the H. pylori because that is the reason she's not digesting any of her food. So these are the products I use. Pyloricil, it's mostly mastic gum. Mastic gum seems to be the thing that kills off H. pylori. DGL Synergy, which is a deglycerized licorice root. So it's a licorice root without the effects that it can have on hormones. So very good for the stomach. And then Matula tea, which is a really, really healing tea. It's a combination of different flowers and herbs that are picked at very specific times of the year, but it's pretty awesome at getting rid of H. pylori. If I have H. pylori with a client and there aren't those virulence factors or those factors pointing to having the type of H. pylori that leads you to stomach ulcers and cancer, I may not add in Matula tea, but because she had that more serious strain of H. pylori, I did add in Matula tea. So then we did a third 60-day protocol for that last parasite, the Pentachromis hominis. And so Amazon AP, this is her product that's Rainforest Botanicals. So really effective herbs for getting rid of parasites. I really, really love these products. We did that for 60 days. And then we did a 4th protocol for 60 days to address the bacterial infection. So I put her on another product with Rainforest Botanicals, but more specific to the bacteria. And then Allison is just really high dose concentrated garlic. So that's really, really effective for addressing bacterial infections. And then the 5th protocol, the final protocol, was for the yeast, for the Candida and the Microsporidium. So I did another product with Rainforest Botanicals for fungus, and then Candid X, which will help address that Candida that she had. For detox, we had daily coffee enemas. I know those probably sound scary, but they're very effective for detox. We had her doing regular castor oil packs and sauna therapy. And then of course I did send her to her physician for celiac testing to see if that was something that she had because of that really elevated immune response to the anti-gliadin IgA. Okay. So we did that. This took about 6 months. I think this took longer than 6 months. This was a long protocol. We had 5 different protocols. So this is probably about 8 months. So at 8 months, we checked in and she actually had experienced a lot of improvement. So her fatigue had improved. She was still having migraines, but they were becoming less intense and less frequent. She was experiencing less bloating. She was starting to have more regular bowel movements, but they were still hard to pass. So still a bit of constipation there. She did notice that she was sleeping better. And she was adhering to the recommendations. And, you know, no one's perfect. She wasn't perfect, but she was doing a really good job. She did manage to cut down on some stress. She cut down on work hours. She was pursuing a new job opportunity, which she was feeling very excited about. She took up a new hobby and she cut down on her exercise, which even though she was resistant, she did find that really helped. And it turns out the celiac test was negative, so she did not have celiac disease according to her doctor, but because of the elevated response to it, strict gluten-free diet. Okay, so let's look at what her second test looked like. Okay, so this is kind of interesting, and this is actually a situation that I see a lot. Sometimes the retest, you get rid of one round of infections and a whole bunch of new infections show up. Very common. That's just because, you know, the gut is a deep, dark place. There's a lot of things that are in there in such small amounts. And once you get rid of one thing, you kind of make room for these other things. They kind of come out of hiding and show their face. It's not a bad thing. It shows that the protocol is working. So it's not uncommon to have to go through another round of treatment after the first one. Or sometimes you just don't get rid of those initial infections. They need a longer treatment. Everyone's different. So this isn't straightforward. There's no cookie cutter approach. What I do for you is very different for what I do for her or him. Okay. So the good news is we got rid of those big bad infections. So we got rid of the Entamoeba histolytica, we got rid of the Giardia, and this is awesome. We got rid of the H. pylori the first round of treatment, which doesn't always happen. So that was awesome. But what we did see is this Clostridium difficile, or C. diff. So this is a very nasty bacterial infection. It's very resistant to antibiotics, and typically people get it from taking too many antibiotics. And Lacey did have a history of antibiotic use. Plus, it's rampant in hospitals. So if you spend any time in hospitals, if you are a hospital worker, a nurse, a doctor, there's a good chance that you might have this. And if you spent any time, you know, visiting relatives or friends in the hospital, and she did have a sick mother, so she was spending a lot of time in a hospital. We never really know why people get these or when they pick them up or how long they had them for, but those are definitely some risk factors. C. diff is nasty, causes a lot of toxin production. This one can be fatal as well, although mostly in people who are immunocompromised or really elderly people, but definitely not something that you want in your stomach. Okay. So this is a new protocol that we're going to have to put her through. If we scroll down, we're actually seeing some improvements in her bacterial flora, which is good. So that probiotic is helping. And just the fact that we're getting rid of these major infections is actually really increasing the rate at which your friendly flora can grow. So we got rid of the Citrobacter, we got rid of the Protea. So this is all awesome. But we did have another parasite pop up, and this is actually really common. So the H. pylori that she originally had, it tends to travel with Blastocystis hominis. The two seem to come together, although I rarely see them come up on the same test. So usually I'll see one on the first test, and on the retest, the next one comes up. That's pretty common, although I did just have a client yesterday where we saw both on the same test. So it does happen. So we're going to have to do another parasite protocol for Lacey. And then we did do a pretty good dent in the Candida and Microsporidium fungus. They were moderate before, so now they're low. So yeah, she needs a bit of a longer protocol for this, but what we're doing is working. We just need to do it for a little bit longer. And then for these additional tests, we can see this is her immune system marker. It's coming back. I believe it was at 135 before, and it's at 526. So her immune system is starting to bounce back. This is awesome. This is the immune system that is reacting to gluten. Excuse me, and it's gone down. It was at 500 before, but it's still high. So after we saw this, she was eating a really strict gluten-free diet. She was doing really good with that. So I had her go through all her personal care products and beauty products and check for gluten in the ingredients, because a lot of these products do have gluten, and that for people who are really sensitive. Okay, so we're back on. I think I just bounced off for a second. As always, I have super crappy internet. So enzyme production is back. It's better. It's above the range now. It's still low from my perspective, but we're starting to see better pancreatic enzyme response. Calprotectin, which is that inflammation marker, has gone down a little bit too. So we're seeing a lot of really good things with this test, which is awesome. And then it's showing in how she feels. It's showing in her symptoms. Okay, so what did we do? So for the second test, we had to put her through another protocol. So we had her continue with everything she was doing because her energy levels were up. I let her add in a bit of resistance training, some interval training as her energy allowed. We continued with all those foundational supplements, but we did have to put her on a few more 60-day protocols. So C. diff, that's the nasty one. This one actually responds really poorly to antibiotics, really poorly to herbs, but it does really well with Saccharomyces boulardii, which is a probiotic. And I do a taper off protocol, which means we start with a high dose and we slowly decrease. Okay, we're back on. So I added in the AP, some GI Microbe X, added in some more things, and then we also added in just a yeast protocol. We continued with what we were doing because it was working. And then I added in some grapefruit seed extract, some caprylics, which is from coconut oil, to just really try to speed that protocol along. And then we continued with everything. Of course, we did have her assess her personal care and beauty products to look for those gluten-containing ingredients, okay? So after this protocol, she again experienced some significant changes. She said she hadn't had a migraine in a couple months, which is awesome. She was reporting better energy and more consistent energy throughout the day. She didn't feel bloated anymore. Her bowel movements were regular and only occasionally difficult to pass. Her sleep was really good, and she said she was following the guidelines about 90%. So she was doing a really good job. And this is what we saw on her third test. Okay, so this is test number 3. We can see the C. diff is gone. Sorry guys, having internet connections, but I'm going to keep going here. All her bacteria was up, which is awesome. And this was all looking really clean. The yeast was gone. That parasite was gone. And then where we're seeing, so these are actually, so in between the, I'm just going to keep pushing through these tech issues, guys. And so this is where we're seeing so many good things. So elastase 1, enzymes are way up. They're above 400. This is awesome. Pancreas is keeping up again. We're seeing that her immune response has really bounced back. So it was 500 on the last one. Now we're up to 1300. We're back in that range, and she's no longer mounting an inflammatory response to gluten. That's because she has completely removed it. She's got it out of her diet. She had got it out of her personal care products. She's been really good with that. So that is no longer an issue for her. And then calprotectin, this is the inflammation marker, and that is way down. So this is a really great success story. And this is typically what happens when I work with clients. It's not always done after the first round. Like one test usually isn't enough. We have to work through a couple. This probably took a full year to complete, or just a little bit over a year, maybe about a year and a half. But it's not a long time, because these issues were going on for years. She had this going on for 15 years. So 15 years, a year and a half to heal. I actually think that's pretty good. That's why I love testing. If you want a copy of this case study with everything that I did to help her, you can just type amazing into the comments box, and I'll send it to your Facebook Messenger. We're just pushing through these tech issues. Hopefully I won't have another one. I'll be able to finish this before I drop off again. But if you're interested, you can book a free appointment with me if you just want to chat with me, pick my brain, and see if what you're going through will be a good fit for my program. And of course, if you do want this case study, if you want to take a look at these tests and the protocol that I recommended for Lacey, and you can learn more about me at kendraperry.net.